Our next session will be on the family and community landscape and will be moderated by Terri and Parnell. I'm just wondering, this past season, I guess it's not over yet, we're still in the winter season, we experienced a rather bad flu epidemic with a considerable number of deaths. And I'm wondering whether or not some of this has to do with the communication or poor communication about the need for flu and immunizations and other precautions necessary to eliminate some of the flu epidemic. So maybe we can consider that as a necessity when it comes to community and family responsibilities to some degree. Let's just think about that because it's still pretty much on our mind. Dr. Parnell is a nurse, a nationally recognized health literacy expert, and an award-winning author. She's the principal and founder of Health Literacy Partners, LLC, which is a corporation that specializes in providing a tapestry of solutions to promote health equity by enhancing person-centered care, by enhancing effective communication, and also the patient experience. Previously, she was Vice President for Health Literacy and Patient Education for the Northwell Health System, which I know very well, Terri. Terri is a clinical associate professor in the graduate program in health administration at Stony Brook University, and she is also a member of the Roundtable. Terri, podium is yours. I'll take my coffee.
These aren't yours, right? No. Okay. Thank you, Bernie. Oh, good morning, everybody. So I realize this panel is between you guys and lunch, so we'll make sure we keep everything right on schedule. I'd like to just take a moment to thank the staff of the Roundtable for this spacious room with desks and everything, so it's really comfortable, so thank you very much for that. So we have 3 speakers for this session, and I'm going to just go through the brief bios, but for Roundtable members that have their booklets, the full bios begin on page 27, if you're interested. So first we have Dr. Jennifer Wolf. Jennifer is a professor of health policy and management at the Johns Hopkins Bloomberg School of Public Health with a joint appointment in the Division of Geriatric Medicine and Gerontology in the Johns Hopkins School of Medicine. She also has an appointment as a core faculty member in the Johns Hopkins Center on Aging and Health. Dr. Wolf has more than 15 years of experience as a funded investigator in health services research and gerontology. Her research has primarily focused on late-life family caregiving and innovative models of care for older adults with complex health needs. And her most recent work has focused on developing interventions that more effectively involve family caregivers in older adults' primary care. Our second speaker is Dr. Stephen B. Thomas. Stephen is the director of the Maryland Center for Health Equity and professor of Health Services Administration in the School of Public Health at the University of Maryland in College Park. He is one of the nation's leading scholars on community-based interventions to eliminate racial and ethnic health disparities, including obesity, diabetes, hypertension, HIV/AIDS, and violence. He is also the principal investigator of the Center of Excellence on Race, Ethnicity, and Disparities Research, funded by the NIH National Institute on Minority Health and Health Disparities on the National Bioethics Research Infrastructure Initiative, Building Trust Between Minorities and Researchers. The latter focused on plain language delivery of scientifically sound and culturally relevant research with racial and minority populations. He was also awarded the 2005 David Satcher Award from the Directors of Health Promotion and Education for his leadership in reducing health disparities through health literacy and the improvement of health promotion and disease prevention programs for adults age 50 and over. In 2004, he received the Alonzo Smith Yerby Award from the Harvard Chan School of Public Health for his work with people suffering poor health literacy and the effects of poverty. And last but not least, we have Nora Super. She serves as the director of the Aging and Disability Business Institute at the National Association of Area Agencies on Aging, also known as N4A. The Business Institute was created in April 2016 to build and strengthen contract-based partnerships between community-based organizations and the healthcare system. Led by N4A in partnership with several leading aging and disability organizations, the Business Institute serves as a national resource center for agencies interested in acquiring the tools and resources to successfully adapt to a changing healthcare environment, enhance their organizational capacity, and capitalize on emerging opportunities to diversify funding. Prior to joining N4A, Nora served as the executive director of the 2015 White House Conference on Aging. She was responsible there for directing a nationwide effort to identify and advance actions to improve the quality of life of older Americans. So, Dr. Wolf, may I ask you to please begin? Thank you.